On the onset, I'd like to thank our HOD ma'am for her kind permission to organize this day, mental health day, and I'm very much glad that our HOD, ex-HOD of biochemistry also attained here, and our ex-HOD from Rampurhat Medical College is also present here from far end. I'm very much grateful to them and my colleagues and my PGT, and I'm very much glad that Sun Pharma they are sponsoring the program. So before going to start my presentation, I like to thank that. I like to say that this is the first time in our department we are going to organize this mental health day. The mental health day, madam, aptly says that from 1992 it was first done, and then this year we are also observing the mental health day. So mental health is a human rights. It's a time that mental health is available for all. The quality, accessible primary health care is the foundation of the universal health coverage and is urgently required as the world grapples with this current health emergency. Madam says that COVID-19 pandemic. We therefore need to make the mental health a reality for all, for everyone and everywhere. So time for this, the time action is now. It is never too late to do something. So under this background, our today's presentation, or today my topic is investing in psychiatry, meaning and feasibility. What we mean, that what we are going to invest in this year. So the investment is very important. Investment is not a huge investment. Investment for personal capacity, you can invest anything. So mental health has been hidden behind a curtain of stigma and discrimination for too long. So you see the discrimination, how everywhere the mental health is become isolated. So it is a time to bring it into open. The magnitude, suffering, and the burden in terms of disability, cost for the individual, family, and the society are staggering. In the last few years, the world has become more aware of this enormous burden and potential for mental health change. So we need to enhance our investment in mental health and subsequently need to do it now. So mental health is one of the most neglected area in public health. 1 million people are living with a mental health disorder. And 3 million people die every year from the harmful use of alcohol. 1 person dies in every 40 seconds by suicide. In the low and middle income group of countries, more than 70% of population are not getting any chance to go to the doctors. And they don't practically receive no treatment in their condition at all. Furthermore, the stigma, discrimination and punitive legislation and human rights abuse are still widespread. So, countries spend just 2% of their health budget on mental health, where it is the 30% of the total burden of the disease. So United Nations shows that if you invest $1 in mental health, for the common mental health disorder like depression and anxiety, there is a return of $5 in terms of improved health and productivity. So let's invest more for the mental health. So what kind of investment? And the Lancet, and in this 2020, it says that investing in the global mental health, the time to action is now. There's a huge paper is presented in the Lancet. The investment, what type of investment? The investment, the financial and human resource. A higher proportion of the national budget should be allocated to developing the adequate infrastructure and service for the mental health. At the same time, more human resources are needed to provide for those with mental disorder and to protect and promote mental health. So you see that only how much the infrastructure is present scenario. Only 0.75 psychiatrists per 1 lakh population is present, but our need is 3 per 10 lakhs, 1 lakh population. So that's a huge gap. And nowadays, in each year, we are the only 9,000 psychiatrists all over the India, and every year only 500 psychiatrists is added to this pool. So, country needs to establish specifically targeted policy, plan, and initiative to promote and support the mental health. So, who needs to invest? It is not all the government and the multinational company they come forward to invest. They are investing, but all of us with interest in the health and development of people and communities, we can invest. The international agencies also there. The developmental aid agency, trustee board and foundation, research foundations, business and government, they all are there. But everyone can contribute here. What do we expect from such an investment? We are expecting that we should be able to provide much needed service, treatment and support to the people suffering from mental disorder than they receive at present. So service that are more effective and more human. This is very important. The treatment is there, but human touch should be there. During the investment of during the actions of this mental health act in 2018, this human touch is very important. At the same time, the insurance issue is also there. Come later on. So treatment that help them to avoid the chronic disability and premature death, and support that gives life a healthier and richer, a life lived with a dignity. So when you invest in mental health, you will receive multiple return in terms of business, in terms of individual, in terms of economic, in terms of society. So economic burden of the mental health. The cost of the real problem in developed countries is estimated 3 to 4% of the GNP. In the developed country, the well-organized care system, 44 and 70% of people with mental health do not receive any treatment. In developing countries, the figure is more worse, and the treatment gap is close to 90%. So investing in mental health today can generate enormous return in terms of reducing the disability and preventing premature death. So mental health and mental health illness are integrated. This is comorbid mental health is always present with our leading disease which we are treating in our tertiary all level of hospital, like hypertension, infection, leprosy, stroke, diabetes, cancer, HIV/AIDS, and tuberculosis. And you see that the prevalence is much more in these type of diseases. So we have to treat the comorbid patient to enhance the adherence to the chronic disease treatment. We are see that the people are not taking that anti-tuberculosis drug. We are not seeing the people are not taking anti-cancer drug. To increase adherence to this drug, it will be done when you again address this mental health. So it will be decreased the risks of disability and morbidity if the adherence is improved. The burden, the family burden cannot be ignored. The family burden, we don't feel that the caregiver roles. We are not neglected all the caregiver because we think it is their duty. But you don't feel, you don't quantify the level of agony, the level of deprivation, because we are concerned about the patient, but as far the patient is concerned, the caregiver, without the caregiver, the patient is nowhere. So you see that the mental health disorder is a significant burden on the family, and it is difficult to assess and quantify, and consequently often ignored. We are not look for that. And in other clinical clinics, we are seeing that people, those who bring the patient, their faces, the caregiver, those who bring the patient to the OPD, they are condition is very worse, but we are not think about that. We are not probe any questions to them. What is your health? Because I think the people who bring this patient to me and I'll concerned about that patient only, but they are not so concerned about the family member. So significant impact of the family's quality of life. There's a great deals of quality is hampered, but we are not thinking about it. So talking about the mental health disorder means talking about the stigma and human rights. The human rights is always sacrificed when you talk about the mental mental the person having the mental health problem. So in addition to social economic the sufferings from mental health illness are the victim of human rights violation, stigma and discrimination. This is a very important example of a human rights violation. You can have any idea about these things? Have you any idea? Have you seen these things? It was a huge headline. It's basically it's a 20 people in the mental health home in Iduara. It was a custom that the peoples, those who are present in that home, they tied in the with the, in the tree with a thick rope, and evening in the night they're chained with their bed, and it's a very sad incident that there is a due to the fire outbreak, all the inmates was in that asylum was died. But we should not chain. There is a no rules is there to chain anyone. Resistance the people we can do that is in presence of some people, so responsible people. So this is a very important issue, and from that time this asylum was closed, and the chain is totally banned in anywhere. So, huh? এটা 2002-3 এরকম হবে 2-3 না 2-3 হ্যাঁ 2000 এখন রিসেন্ট ঘটনা রিসেন্ট ঘটনা পা বাঁধা তো সবসময় আছে পা বাঁধা ইউ ক্যান সি দ্য পা বাঁধা ইন এভরিওয়্যার মানে বাঁকুড়াতে গেলেও আমি দেখতে পাচ্ছি না না ওটা চেন দিনের বেলাতে এটা তারা চেনের সাথে গাছের সাথে বেঁধে রাখে, রাতের বেলাতে চেন দিয়ে বেঁধে রাখে, লোহার চেন দিয়ে। তার ফলে আগুন ধরার ফলে ফুললি চার্জ কোনো বডিগুলোকে আইডেন্টিফাই হ্যাঁ সে তো আছে। এই আপনি দেখতেও পাবেন যে শেকল দিয়ে বেঁধে রেখেছি কাউকে মানে কুকুর ছাগলের মতো ব্যবহার লাইক ক্যাটেলস। So economic burden of the mental health. You see that how the mental economic burden of is appear. There is a sufferer, that is the patient. There is a care cost, the productivity cost, and other cost. Care cost means direct treatment and their medicine cost and the fees of the doctors, and productivity cost the persons those who are engaged in any type of activity, that activity is closed, and that is why the people run by the family is also sacrificed. The family also suffer. Another cause abuse and suffering and treatment side effect, and they are committing suicide. If the person is committing suicide, the families also suffer. It is not that individual person, that family is committing the result of that suicide we have to bear. The family and friend, they are the informal caregiver. They also the cares come and when they bring the patient in the hospital or OPD private chamber, then their day life productivity in that days will be hampered. They have to spend time. They have isolation, stigma, and anguish. Family also. Employer has to contribute treatment and care, and they reduce productivity as their employees are suffering from mental disorder, any type of disorder. Society, the provision of the mental health care and general medical care, their taxes and insurance, everything is the government liabilities, and the reduced productivity is again, and the loss of life, untreated illness, unmet need, and social exclusion. These are the economic burden of the mental health disorder. And the type is different. Direct cost, There is a treatment and service cost and other non-healthy costs, the social welfare administration, public and private criminal justice system, transportation. If somebody is doing any crime, then also you have to go to the justice systems, and there's a lots of wealth is spent here. And direct indirect cost is morbidity cost in terms of value of lost productivity, mortality cost, and in other cost is the value of the family caregiver time. That is also taken into consideration. So high cost of mental health disorder compared to other major condition. You see the psychosis, neurosis, diabetes, cancer, ischemic heart disease, and you see that how the money is spent, how the dollars in terms of pound is it is shown, inpatient, outpatient, and primary care, pharmaceuticals, community health, and social service. It will shown in bar diagram. Yes, cancer is more than cancer. So you see that high cost of the mental health disorder compared to other major conditions. Alzheimer and schizophrenia. You see that how much cost is government yearly cost is spent in terms of your cancer, CSD, diabetes, hypertension, osteoarthritis, stroke, etc. But we are not concerned about this mental health in spite of this figure. So many developed countries, 45% of the absences from the work is due to the mental health problem. Whether they call the headache or not, but this is the mental health problem. The burden of the substance abuse. You see that 76.3 million people are diagnosed with the alcohol disorder. At least 15.3% affected by disorder related to other drugs. And between the 5 to 10 million people are currently inject drugs, and 5 to 10% of the new HIV infection globally result from injecting drugs. The more than 1.8 million deaths in 2000 were attributed to alcohol-related deaths. So the government and drug abuser and the family shoulder the main economic burden of the drug abuse. So every dollar invested in the drug treatment and $7 saved in health and social cost. So burden of the substance abuse. You see cost in alcohol abuse, loss of productivity, healthcare, vehicle costs, criminal justice system. So you see, this is a very important slide in terms of community medicine people, because you see the access alcohol consumption. When you go to the field visit and family, you see that they are excessive alcohol consumption. Due to excessive alcohol consumption, more money is spent and less income and less and more loan is there. And so sickness, absenteeism, the job loss, acting rickshaw chaliye 3 din eto mot khelo je they are lying down on the road. 3 দিনের জন্য তার রিক্সাও চালাতে পারলো না, and their family are going to starve. The minor convictions of মারধর করছে, and accident and injuries, gambling, জুয়া খেলছে, and their financial problems. That financial problem lead to the less food, less education, poor living condition, which leads to the wife and children to work. তাদের বাচ্চাদের স্কুল ড্রপ আউট হচ্ছে, they have to leave the school, and তাদের বাচ্চাদের ছোটবেলায় teenage pregnancy, teenage marriage, and also the social stigma ties হয়ে আছে that মদ করে বেটা, the drug addict, the people are coming that their father is a drunkard. The stigma is stamped on their family members, and the family of health of the family member, and they are suffering from malnutrition, infection, or TB, worm infestation, stunted growth of the children. So when you talk about the depression or the mental health, the poverty is always go with hand to hand with the mental health. So there is a vicious cycle among the poverty and mental health. The poverty is violence and trauma, and the mental health disorder, these poverty, suicide, alcohol addiction, depression, substance abuse, child abuse, development problems, post-traumatic stress disorder. Then again the problem. This is going on. So what is the cost of effective treatment? You see that in cost by the 4 major illness of the psychiatric illness, like the schizophrenia, bipolar, depression, and post-panic disorder. These are the four basically major disorders which we has to face in our daily practice. You see that country-wise their contribution and the annual cost of that diseases. So there is a huge gap between the burden of the mental health and the resources. You see that red portions is treated and untreated portions is yellow. So you see that relative position into the schizophrenia, the 40% is they are not getting any treatment. In major depression is nearly 55%, so 50% is not getting any treatment, untreated. And you see the alcohol is most of the people think they are taking alcohol. Why should I treat? Let them die. And on the childhood abuse, we are not think about the childhood illness. If the people বাচ্চা ছেলে যদি বলে যে আমার মন খারাপ করছে, we are not thinking about that বাচ্চাটার মন খারাপ করছে, we are not take it seriously, পড়াশোনার ভয় এরকম করছে আমরা মনে করি. So share of the mental health budget in the total budget country by income level. You see low income level, how many budget? 1.5%, and low middle income group 2.75, and a high income group will 3.49, and a high income group 6.89% budget is allocated to mental health. So wide gap between the burden of the neuropsychiatric disorder and the mental health budget. You see that the 30% of the global budget burden of the disease, and again only 2% get the health expenditure in terms of mental health. So there is a several barriers of the public health access to appropriate mental health. That is stigma, discriminations between the insurance coverage and mental health disorder. And still 2018, the psychiatrists are never allowed to, they are not able to admit their patient in the nursing home and hospital because the insurance was not covered. And after 2018, it is a huge upliftment for the in terms of mental health treatment. They are able to get the insurance benefit after 2018. Before that, people are not able to get the insurance benefit for the mental health, and that is why if some persons are suffering from mental health, the persons are admitted from other physician, and the psychiatrists go as a invitee as for the invitee clinician to see that patient. So there's a dual type of extra money is spent and wastage due to this mechanism. Right? And these things is not as because this is recently started. All the nursing homes are not willing to take this type of mental health patient in the nursing home. The lack of rationally a comprehensive mental health policy rational and legislation. And 40% of the country do not have the mental health policy, and then 25% country do not have the mental health legislation, and 30% countries do not have national mental health program. So in 2011, WHO is launched WHO Global Action Program Mental Health Gap. So that is the fourth pillar of this thing. That is information for the better decision, advocacy against stigma and discrimination, integrated policy and science development, and enhanced public health research capacity, which leads to increase countries' capacity, enhance mental health services, reduce stigma and discrimination, reduce disease burden, and enhance mental health and enhance mental health population. So much can be done. Everyone can contribute as a whole to for the enhancement of this mental health. So media, mental health professional, policymaker, and science institute, NGOs, families, private sector, foundation, communities, and last but not least individual. And every individual can contribute. You need to much more and more money is needed. It is your simple smile which you can invest to your next door neighbor. It is your empathy that is picked. It is your time you can spend with them that you can invest. So little investment will create the mental health such a level that we can combat all the mental health problem. So with this short within this, I like to thank you and for your present listening, kind listening. And if you have any questions, you can ask.